In the article in the Mail, you're cited as saying that our official data doesn't take into account the picture when it comes to COVID between Christmas Eve and Boxing Day, specifically Omicron. But we do have the daily Omicron overview now, and it's data up until the end of Boxing Day, and that is showing hospitalisations specifically in England at 668, and total Omicron deaths, as tragic as they are, standing at 49, which is the total number since the Omicron reporting of over a week ago. So surely, is that not complete enough data to tell us that cautiously we are seeing that Omicron is a bit milder and that the hospitalisations and deaths are nowhere near where we thought they might be?
I think it does, but it doesn't change the fact that we don't have a complete picture because of Christmas and because people don't want to go getting tested for coronavirus and have swabs and things put down their throats and all the rest of it when they've had a drink, and who doesn't want to do that on Christmas Day? It's inevitable that we don't get the full picture, and there is anecdotal evidence from medics that people tend not to turn up at hospital over the Christmas period, but that probably doesn't make all that much difference to the numbers. But what we're seeing at the moment is not a huge wave of infections. That cannot be denied. The exact reason for that, I don't think we still have quite a good understanding of, but it doesn't really make any difference. That's where we are as a country. But to pretend that we have the whole picture over Christmas, the Christmas period, and going into the new year, I just don't think that's true.
But if Omicron, as the University of Edinburgh seem to think now, Imperial College seem to think now, even the UK Health Security Agency have now come out and said, and it varies, but some of the reports are up to 70% a lower chance of hospitalisation with Omicron. Even some of the people now are coming out and saying as well, we can't say that people are in hospital because of Omicron. They've gone to hospital for other reasons and then been tested with Omicron. If you take all of that into account, why does a higher number of infections really matter if it's a far milder strain?
Because let's take 70%, 2/3. If you have a virus that puts 2/3 the amount of people in, sorry, a third of the amount of people in hospital than, say, Delta did, but you have before Christmas 3 times the number of infections that you had at the same point last year, then that's wiped out your gain from the decreased virulence of Omicron, however that's come about. So that's how that is wiped out. That's what the problem essentially is.
But why aren't we seeing higher hospitalisations yet then? Not necessarily specifically with Omicron, but in general. I mean, if you looked at a year ago now, hospitalisations were absolutely, I mean, by the 29th of December 2020, they stood at 3,252 a day. They were at that sort of figure. At the moment, the last daily hospitalisation rate that we have, which was for yesterday, I'm just refreshing to see if today's has come down yet, is at 1,100. They're at about a third of hospitalisations from a year ago.
Because a year ago, nobody had been vaccinated, and certainly nobody had had a booster. And I think it, at least in part, it might not account for all of it, but at least in part, the immunity that we've got as a population accounts for at least some of that reduction.
Well, then that's a good thing. So doesn't that justify not having restrictions then for
It is a good
New
thing.
Year?
Yeah. At no point have I said the government needs to have more restrictions. So don't come that one.
Oh no, I'm not trying to. I'm probably not trying to catch you out. I'm just trying to, because you're cited here saying, no one wants to live under tighter controls. I'll quote what you said in the Mail, so everyone knows where you stand. University of Reading cellular microbiologist Dr. Simon Clark warned official data doesn't take into account the picture in Britain between Christmas Eve and Boxing Day, but we do have some now, which I just cited. He suggested the move was based on incomplete data and would only become clear how the virus was moving through the population in another week or so after New Year's Eve has taken place. Dr. Clark said, and I quote, "While nobody wants to live under tighter controls, the public need to realise that if we end up with a significant problem of hospitalizations and mass sickness, it will be worse than if the authorities had acted earlier. So
Yeah.
does that mean that you want some sort of action, the authorities to act in some way, or not? Tell me where you stand.
No, where I stand is it's just what I think is a rather clear-eyed acceptance that we don't need to keep locking everything down. We don't need to keep restricting everything, but potentially that comes at a cost. And I would just say that that quote was given to a journalist down the phone on Boxing Day evening, so nearly 48 hours ago, when we had even less data than we do now.
And now we've got more data. Does that make you slightly more optimistic or less optimistic?
Oh no, it makes me more optimistic. But that doesn't, as I always say, these things can turn on a dime, and they do. If we've learned nothing else over the past 2 years, the situation can change very quickly. But that doesn't mean we need to lock everything down and restrict everything in case it happens. It just needs to be. We just need to be aware that it can happen.
And do you therefore then believe that perhaps what we've seen in Wales and Northern Ireland and Scotland is perhaps a little heavy-handed, because the data is implying, as are the studies, and I take your point about hospitalizations with the studies, but if the studies are saying that Omicron appears to be milder, if South Africa as well,
Yeah.
and I know the caveats with South Africa,
Yeah.
but they're saying it's milder too, have the other nations in the UK jumped the gun somewhat, maybe?
Oh, quite possibly, yes. But you pay your money and you take your choice, and these are political decisions, and somebody is going to be right, and somebody is going to end up looking foolish.
And do you think that there has been too much of it just in general, when it comes to Omicron, kind of the pessimism and worst case scenario planning? I mean, Sage themselves admitted that they have been sort of modelling for the worst case scenario, but that doesn't account for us all knowing that we need to wash our hands much more, knowing that we do need to wear masks now and then, knowing that we need to have our vaccines, all of these sorts of things.
There has been far too much conjecture, I've got to say, in both directions since I first heard about this new variant from South Africa, which at the time didn't even have a name. And the fact of the matter is, it will do what it's going to do, and no amount of pessimistic projections or even overly optimistic projections is going to change a single thing.
But should the Prime Minister, do you think, perhaps, and Sage, because I've spoken to people, and I know you've spoken to the media a lot, who have been really adversely affected, especially those in business. We saw what's happened on Boxing Day on the high streets with no one visiting them, bars facing real issues without lockdown official being imposed. People have not been wanting to go out to them. Do you think that perhaps the tone from the Prime Minister and Sage should have been perhaps a little more moderate from the start, i.e. don't panic, keep calm and carry on, we will keep an eye on the data and make a decision when we know more?
I think that keep calm and carry on message could have been made quite clear, yes. But what I will say about Sage and modelling is that there's often a range of projections, a sort of bandwidth, if you like. And unfortunately, for some reason, the media always go to the worst end of things. And I'm often left watching television or reading newspapers and thinking, yeah, well, hang on a minute. They also said the bad effects could be as low as X, not necessarily as terrible as Y. So, the full picture is not always given when it's reported, I'm afraid to say.
No, but I think that when it came to Sage, there was the member of Sage who had an exchange with Fraser Nelson online, and he actually said that they had been asked to model worst case scenario, and that was what the government was working from.
Yeah, so that's a political or civil service decision. We don't know who makes those requests, but I think that they should be a little clearer, and the media should be a little clearer as well in what the range of projections is. And yes, the lesson I expect, although I don't know, has probably been learnt to be a little bit more free thinking in the way you do these things, perhaps is one way of putting it, and to model things right across the spectrum. If the government wants to plan for the worst case scenario, then they're going to ask the simple question, what is the worst case scenario? And it's for them then to decide what they do with that. But to suggest that they don't have economic data, to suggest the First Lord of the Treasury, aka the Prime Minister, doesn't have economic data, I have always found puzzling. I think it's a glib and ridiculous suggestion that's put forward, particularly by some MPs.
But Boris is right at the moment to hold his course for England.
I think he is being proven right at the moment, yes. But of course, that can change.
And do you predict that might change? I know we don't know complete data. I take what you're saying with that, but many people have been saying for weeks that it will actually be either the 3rd or maybe even the 5th of January. Around that sort of time, we are going to be seeing something more heavy-handed. What do you think about that?
I don't see anything in the data yet that would justify that. If the government are to do that, then they need to be able to justify what they do. And as yet, that is not appearing in the data.
Dr. Simon Clark, this has been a far more cheerful conversation than I had expected. I was expecting, because you were cited, and I don't say that as a criticism, I say this brilliantly, but because you were cited in the article saying, and I take what you're saying, that you gave the interview a couple of days ago, that, we don't really know what's happening. I was expecting doom and gloom, but it might not be the case, really.
It might not be the case. There is far too much doom and gloom, and there is far too much denial of what the risks are. It will be what it will be. And I think the one thing I would say is that people making glib, off-the-cuff predictions in either direction are bound to be wrong.
No, I think they should come from reading and from speaking to people, and that's what we've tried to genuinely do here, and I've genuinely held my head up. So does that mean that perhaps you were a little bit wrong at times for being a little bit of a doomsayer when you spoke to the Mail, maybe even?
Well, that was 48 hours ago. Yeah, nobody gets it right all the time.
Dr. Simon Clark, thank you. It's been actually really good to talk to you and really appreciated it. And that's Professor of Cellular Microbiology, University of Reading. Hey, who knew? Who expected that? So, I was really expecting, because he was cited in the article, that, we don't know what's happening yet, blah, blah, blah. I was expecting a doom-laden prediction of, hell, high water and catastrophe. And actually, it looks like what we've been saying all along. I hate to say that we're right here on Talk Radio. Well, I don't at all. But it looks like if we hold firm, we might be okay.